So, you've been in an accident, one of the hardest things someone goes through. What are the first things you need to do? First of all, make sure you're safe. Make sure you're not in harm's way. Secondly, if there's a major injury that's possibly looming, make sure you contact emergency services and get to a hospital. Make sure you're not having any life-threatening injuries. After that, make sure you get information from the other parties that are there. If there's any witnesses, get the other insurance information. Make sure you call your own insurance company and get the ball rolling. If you're past that point, the next day things start to have some issues, now's when you need to call your chiropractor. Now's when you need to come in and find out exactly what soft tissue injuries or spinal injuries might be looming or might have happened because of that accident. It's not bad to go to your MD. It's not bad to go to an urgent care and get a checkup. But chiropractors are uniquely designed in order to really get to the bottom root causes of what could not only happen right now that might be causing your symptoms, but what could happen in the future. The last thing we want to do is have someone in an accident and then they just watch and wait and watch and wait and watch and wait. And then months later, they're still having the problems. And maybe now they're going to have those problems for quite some time or permanently. If we take a patient and we really examine them well, we might examine them through x-ray. Maybe it's range of motion. Maybe it's dynamic electromyography or surface electromyography. Perhaps it's a full postural evaluation with a program called Kinetisense, which we'll talk about in a later episode. And we can evaluate through standard orthopedics and palpation. Chiropractors are really well trained to palpate the spine, to palpate the soft tissue muscles, and make sure that everything is lined up well, that everything is feeling like it should feel and moving like it should move. And then the biggest thing is to be able to not only treat the patient to get them better, but also document well so that the powers that be, the insurance companies and the adjusters, can all figure out and know how to appropriately treat you the best. We don't want to let you kind of slip under the rug. So if you have any accidents, you have any questions, please call my office right away. We'll get you seen and see what we can do to help. Thanks a lot. This is Dr. Kuhn signing off.